So when it comes to hospital accountability for protecting the health and safety of patients, we do again have limited actions that we can take for hospitals.
Addressing Virginia's Joint Commission on Healthcare about hospital accountability, the state's top health official highlighted the Virginia Department of Health's limited powers to hold hospitals accountable for failures.
We can revoke or suspend a license, but it's for the entire hospital, which would be a very drastic situation for healthcare needs, especially in some of our communities that don't have multiple hospitals. We cannot currently impose intermediate sanctions on hospitals at this time.
In her presentation, Dr. Karen Shelton talked about the NICU at Henrico Doctors Hospital, where a nurse was charged with abuse and neglect after multiple babies experienced bone fractures in 2023 and 2024, and where an outbreak of the antibiotic-resistant infection MRSA persisted for 3 years and infected 94 babies. The state cited the hospital in April for multiple deficiencies, including a failure to protect patients from abuse and neglect and failure to control an infection outbreak.
The hospital remains out of compliance. They will be submitting another corrective action plan.
But VDH does not have the statutory authority to impose a fine for the failures, something parents of impacted babies say they disagree with.
They need to come up with laws, regulations that hold these institutions accountable.
Investigating is not enough because 94 babies, that's a high number.
Dr. Shelton confirmed the hospital informed the health department's Office of Epidemiology about the MRSA outbreak right away, and epidemiology worked with the hospital to try to stop the outbreak. But epidemiology does not have the authority to cite the hospital for failures.
Could the Office of Epidemiology contacted the Office of Licensure and said, hey, can you go out and do an inspection because this outbreak is persisting and it's not being reined in?
Well, as we look at the confidentiality of all these matters, certainly the health care of the health of our citizens of the Commonwealth is the most important thing. So we need to make sure that we're breaking down barriers in communication to make sure that we are working together to solve these problems.
Yeah, could it be like the two entities were kind of in silos, maybe not communicating on that issue?
Yes. But at this time, we have had good communication between these offices, and both are working together at this time.
Even if VDH had cited the hospital sooner for failure to control the outbreak, VDH would not have been able to fine the hospital for the deficiency, something the legislature actually gave VDH the power to do this year with nursing homes, and something Delegate Rodney Willett, who represents the area where HCH is located, noted to Dr. Shelton.
So it sounds like we've got a similar gap on the hospital side is what I'm hearing.
Yes, sir.
Okay. Something to address.
As the state health commissioner, do you think it would be helpful, or would you like to have that tool in your toolbox to be able to fine a hospital for an ongoing deficiency?
If there were some more intermediate sanctions, that might be helpful.
Delegate Willett told me that he expects one or more bills to be introduced that would give VDH more enforcement options related to hospitals, something similar to what was already passed earlier this year that allows them to sanction nursing homes. In Richmond, I'm Melissa Hippolyte for CBS 6.